Did you know that syphilis has been around for centuries? Yeah, and it's making a comeback in the United States. That's right. Hey, welcome back to my channel. I'm a board-certified OBGYN. Today's video, I want to talk about congenital syphilis. I know some of you all have heard of it before, and others of you all may be hearing about it for the first time. So, I want to break down exactly what congenital syphilis is, how it's transmitted to our babies, what the symptoms are, and finally, how you can help prevent this terrible disease from affecting your baby. So, let's jump in. So, what is congenital syphilis? Well, it's exactly what it sounds like. Syphilis that is transmitted from a pregnant person to their baby. And usually this happens in the third trimester of pregnancy when the mother has gotten appropriate treatment for her own syphilis infection. The scary thing about this is that most of the time, the mom doesn't know that she's infected because the early signs and symptoms of syphilis often go unnoticed. They can be very vague, like a fever or a sore throat, or they can look like other conditions. So many times people don't seek treatment for those vague symptoms, which means that microorganism called Treponema pallidum, which is the bacteria responsible for syphilis, is able to continue growing and multiplying without treatment. Eventually, that bacteria can cross the placenta and infect the fetus. So what does that mean for the baby? Well, unfortunately, babies aren't always born with the same level of immunity that we have as adults. This means that once that bacteria reaches the fetus, it can really wreak havoc. We're talking about causing major health problems. It's potentially leading to the baby being born prematurely, to the baby having organ damage, skin lesions, bone abnormalities, and in the worst cases, a stillbirth.
Ow!
The other scary thing about congenital syphilis is that sometimes the symptoms do unappear until years after the baby is born. So in the case of late congenital syphilis, the baby may appear to be healthy at birth, but then develop severe health complications such as bone disease, dental problems, blindness or deafness, or other issues like brain damage, liver problems, or lung problems down the road. In 2021, there were 698 cases of congenital syphilis reported in the United States. And although that number is lower than the peak of 10,000 cases in the 1940s, it's definitely on the rise. In fact, congenital syphilis rates tripled between 2014 and 2024, so we're seeing more and more cases each year. And why is this happening? Well, syphilis rates are increasing in the general adult population, and when more people are infected with syphilis, it increases the chances that a pregnant person will get infected as well. Plus, lots of people are not getting tested or treated for syphilis early enough in their pregnancy. Early and consistent testing is so important to prevent this terrible disease from being passed along to the baby. Of course, we also need to recognize that social and economic factors like poverty, lack of health insurance, transportation issues, and unstable housing situations can all make it difficult to get tested and treated for syphilis. However, the good news is that congenital syphilis is preventable and treatable. Here's how. First and foremost, get tested. Ask your provider to draw a little bit of blood and check you for syphilis, especially if you're in a higher risk category. These include people who have been newly diagnosed with syphilis, people who have been in contact with someone who has syphilis, people who have had an STD from a previous partner, and women who are getting care at a health department or a community health center. If you test positive for syphilis, don't panic. It's treatable. Your doctor will likely prescribe you a course of antibiotics to cure the infection. Once you complete the course of antibiotics and get a full recovery, your baby will be safe. Okay, one last thing. It's really important that you encourage your partner to get tested for syphilis as well, even if you've been cured if your partner still has syphilis. You run the risk of getting reinfected, which could potentially put your future babies at risk. Remember, knowledge is power. Stay informed about congenital syphilis, spread awareness, and take the necessary steps to keep both yourself and your baby healthy. I hope you enjoyed today's video. If you did, make sure you subscribe and leave me a comment below. Share this video with your friends and family and loved ones. And as always, I will see you next Monday.